So I thought I'd make a short video with some tips on when we first bring patients back, both from medical assistants and the providers. Just a couple things that you make sure you do. There's been a number of errors, but these couple things will make the visit go much easier. So when you eventually get to the note, you'll get to this. Here's a test patient. So this is what your screen looks like when you first check the patient in. And you've gone to create the note. In the top left, you want to go to the visit settings screen in the top left, click on that manage button, okay? You want to make sure all these things are correct. So up at the top, make sure it's with the correct provider. I don't know why we have everybody on here, but make sure you're with the correct provider. Then you want to make sure this bill visit as, so this screen right here, this is where you choose what type of patient it is. For any established patient or post-op even, they're going to be established. The question is new patient. So new patient, which is the top one, versus outpatient consultation, non-Medicare only. So that's your fourth one. So these are the ones you want to choose between. If they're Medicare, they're a new patient. If they're not referred by a physician, they're a new patient. If they're referred by a physician, it's outpatient consultation, non-Medicare only. That'll allow you to build a different code and have higher reimbursement. As you go down, the referring provider and primary care will be in there. If you want, it's a good idea to turn this in mention in visit notes, and you can turn the auto fax on. There's a little box on these notes where mention in visits notes. It's probably good to turn this on. That way you don't have to type it in. And you can auto fax if you want as well. I think there's a way to turn that on automatically. I have to look into that. Okay? Second area, the text you need to look at is when you go to the More button up on the top. So the More, the three little dots, there's lots of things that are in here. One of the things you want to look at is the Edit Patient, which is in the top left. So Edit Patient, second one over, top left. You click on this and it brings in their information. So you can, in the upper left, you can click on the Take Photo. So, you take a photo of the patient, okay? Any kind of demographics, that should all be in there. The next thing, so remember PPP, photo, pharmacy. You want to make sure their pharmacy's in there, okay? Whoops, sorry. And then the last thing is practice data. So this is where you will make sure their primary care doctor or referring doctor is in there. So if their primary care doctor is one person, let's say it's Dr. Reddy. You can click that, okay? And if they're referring provider, perhaps let's say it's I don't know, let's say, but it came from Dr. Litchfield or something like that. So you want to add those in there, okay? That'll be in there. So let's just do this for a second. So let's say the referring doctor is Dr. Reddy, okay? But let's say it's let's say it came from Mullen, okay? Let's save that. Whoops. And save. Forgot to click save. So save that. Okay? When you go back to the manage screen, then these doctors will be in the bottom. Okay? And then if you want to send that, you can then click on those providers. It was referred by Dr. Mullen, and fax to those too. That's going to save us a lot of time. So hope this helps. I'll try and do these every once in a while. Hope everybody